am Dr. Danny Stroughton-Duncan, the Director of Education here at COLA. For those who are passionate about laboratory science and interested in staying up to date with the latest accreditation news and industry insights, Talk Lab to Me is an engaging discourse podcast hosted by COLA, a leading physician-directed accrediting organization that provides education and accreditation services to laboratories of all sizes. The podcast covers a wide range of topics, including the latest developments in laboratory science and medicine, as well as in-depth interviews with regulators and industry thought leaders about the importance of regulatory compliance. If you have any questions or comments about the podcast or the topics discussed, please feel free to contact us by filling out the form in the description. And don't forget to follow us and share. But before we get to that, are you looking to network with your colleagues? Do you need continuing education credits? Or do you just want to talk about your favorite technical topics? Join me at COLA's Laboratory Enrichment Forum, happening May 6th through the 8th, 2025 in Chandler, Arizona, where the focus will be laboratory science supporting the healthcare ecosystem. Welcome to COLA's Talk Lab to Me. I am Dr. Danny Stroughton-Duncan, the Education Division Director. I am here to welcome you to the first episode of Talk Lab to Me. We are so excited. And I am joined today with someone who is absolutely an industry thought leader and a wealth of knowledge. And I am not just saying that because she is my boss, but I would like to welcome COLA COO, Kathy Nucifora.
Thank you, Danny, for that warm introduction. I really appreciate that. I'm so honored to be a part of this inaugural podcast, and I'm very honored to introduce our guest speaker, Daniel H. Hesselgesser. Daniel is the Survey Branch Manager for the Division of Clinical Laboratory Improvement and Quality at the Centers for Medicare and Medicaid Services. He's worked with the CLIA program for 20 years and recently retired as a captain from the U.S. Public Health Service. So welcome, Daniel. We're so happy to have you.
Thank you, Kathy and Danny, for inviting me. I'm excited to do this podcast and disseminate this information. First thing I need to do is to put out a disclaimer, as I am an employee of the United States federal government and CMS CLIA program. This podcast was prepared for informational purposes and is not intended to grant rights or impose obligations. Every reasonable effort has been made to assure the accuracy of the information provided. This podcast is a general summary that explains certain aspects of the CLIA Laboratory Improvement Amendments CLIA program. The official CLIA program provisions are contained in relevant laws, regulations, and rulings. Please refer to the CMS and CLIA web pages for pertinent information. The Centers for Medicare and Medicaid Services employees, agents, and staff make no representation, warranty, or guarantee that this compilation of CLIA information is error-free and will bear no responsibility or liability for the results or consequences of the use of this information. Thank you.
Thank you, Dan, for sharing that with us. So let's get into what we're here to do. Talk Lab to Me. Kathy, would you start us off?
Sure thing, Danny. So on December 28th of this year, there's some significant CLIA personnel revisions that will take effect. We've got questions about some of the specific changes, but before we go there, will you please give us a brief description of how CLIA revisions, both proposed and final rules, are developed and the steps that CMS has to go through before the revisions are finalized?
Absolutely. So in general, the process of making changes to the CLIA regulations involves gathering information on a topic through CLIAC recommendations, which CLIAC is the Clinical Laboratory Improvement Advisory Committee, and then an RFI process, which is request for information, and then seeking public comments on the proposed regulatory changes in the proposed rule and finalizing regulatory changes in the final rule. So the CMS proposed rule for the CLIA regulatory updates to the CLIA fees, histocompatibility, personnel, and alternative sanctions for CLIA waiver laboratories was published on 7/26 of 2022. The proposed rule was open for public comments for 30 days, and we received 20,574 comments. All comments were received in conjunction with our CDC partners. We published the final rule on 12/28/2023. The final rule included the CLIAC recommendations from the April 19 CLIAC meeting and public comments received from the 2018 RFI, or Request for Information. The 2018 RFI for the CLIA regulations to personnel regulations, proficiency testing referral, histocompatibility regulations, and fee regulations was published on January 9th of 2018 with a 60-day public comment period.
Well, thank you, Dan. That's quite a process. We appreciate the explanation. So several of the most significant CLIA personnel revisions are related to the laboratory directors. The requirement that laboratory directors visit the laboratories that they direct in person a minimum of twice per year, at least 4 months apart, seems reasonable and doesn't seem to be too controversial. These on-site visits must be well documented. So can you give us some examples of the types of documentation that CLIA will consider acceptable to adequately verify these on-site visits?
So first of all, CLIA is not prescriptive about the types of acceptable documentation. Like most things, the laboratory director determines the documentation needed to provide evidence of an on-site visit. Some examples of things could be proficiency testing reviews or attestation statements, procedural sign-off, and competency assessment sign-off, and analytic systems documents review. Additional forms of documentation could include like staff meeting minutes, sign-in and sign-out logs, or travel vouchers when they made those on-site visits.
Thank you, Dan.
So now that we're talking about documentation, CLIA states in no uncertain terms that documentation to support required years of experience is absolutely necessary. In other words, a CV or a resume alone is not sufficient for verification of required experience. This could prove to be difficult for personnel whose qualifying experience is more than 2 years past, as laboratories are not required to maintain much of the compliance documentation for more than 2 years. So, for example, someone who wants to serve as a technical consultant for a moderate complexity laboratory must show evidence of at least 4 years of laboratory training or experience. If that person's experience was 3 years ago, and let's just say the facility where they got the experience has since closed, can you give us some suggestions of what documentation would be acceptable to verify that experience?
So to clarify, only the individual who is qualifying as a technical consultant with an associate's degree is required to have that 4 years of laboratory training and experience in non-wave testing. And again, CLIA is not prescriptive about the type of documentation, but as you have said, the CV or the resume alone is not sufficient evidence for laboratory training and experience. As a prior surveyor, some of the documentation that I've seen that could meet this requirement would be letters on official letterhead from previous employment, competency assessment records, and a comprehensive list of job responsibilities are some possible documentation. Other things could be log sheets or certificates from training and attestation statements from laboratory directors documenting the training and experience are other examples of acceptable documentation. One other thing important to note is documentation supporting an individual's education, training, and experience must be generated by someone other than that person that's attempting to meet the CLIA personnel requirements.
Okay, so a physical science degree at its face will no longer be a qualifying degree for CLIA positions. The CLIA revisions allow for an educational algorithm so that CLIA surveyors and accrediting organization surveyors can review transcripts to evaluate whether there are enough semester hours of science courses to qualify the person. I have friends who have physical science degrees, so I'm very interested for those people who have physical science degrees and have had substantial laboratory experience. Do you recommend that they make sure that they are prepared to have transcripts available in case they seek to serve in a CLIA position at a new employer after December 28th?
In the final rule, there is a grandfather provision for each CLIA personnel position for individuals who are qualified and employed in their current position. The regulation for the grandfathering provision states, notwithstanding any other provision of this section, an individual is considered qualified under this section if they are qualified and serving as the individual in a CLIA certified laboratory as of December 28, 2024, and have done so continuously since December 28, 2024.
Thank you, Dan, for that. So is there any other advice for them?
I would definitely have them have their transcripts available, especially as our accrediting organizations and state agencies may have more stringent requirements.
Okay. Other than board certified podologists, those seeking to become directors of laboratories with CLIA certificates of compliance or certificates of accreditation on or after December 28th must complete the 20 continuing education credits on laboratory director responsibilities before they can serve in that role. Did this requirement come from seeing laboratory director citations on the list of top citations year after year?
The new qualification requirements for lab directors to have completed the 20 CE credits on the laboratory director responsibilities is the result of the 2019 CLIA recommendations for personnel and that 2018 request for information. We explained in the preamble section of the final rule that there were 9 CLIA recommendations for personnel, which included requiring the 20 CE credits for laboratory directors.
Will CMS monitor the impact of this requirement on top citation in the years to come?
Absolutely. So CMS currently monitors deficiency trends from year to year and will continue to do so.
Dan, this is Kathy again. There is one CLIA personnel revision that could potentially have a significant impact on rural physician office laboratories. As of December 28th of this year, physicians seeking to serve as moderate complexity laboratory directors must have both the 20 CE and 1 year of experience directing or supervising non-wave testing. Many rural clinics have succession plans for their laboratory directors, and they've counted on another physician in the practice being able to take over as laboratory director when the current director retires by simply completing the 20 CE course. Since the final rule is effective exactly 1 year from the date of publication, the revision could make it difficult for rural POLs to obtain a qualified director when a laboratory director retires. At least for this revision, was there any consideration given to making the final rule effective 2 years from the date of publication so that physicians with plans to take over as directors of POLs would have enough time to get the experience before the effective date?
While some of the updates to the CLIA regulations in the final rule became effective 30 days after publication, such as the CLIA fees, alternative sanctions, certificate of waiver laboratories, the effective date for the updated personnel requirements was delayed until 1 year after the publication date. The 1 year period is intended to provide time for the laboratories to prepare for the updated CLIA requirements, such as the new laboratory director qualification requirement. As we explained in the proposed and final rule, historically, laboratory director citations are among the top 10 condition level deficiencies cited by our surveys. We believe the new requirement to have both 1 year of directing or supervising non-wave laboratory testing and completing the 20 CE credits for the laboratory director responsibilities will ensure the laboratory directors have a better understanding of their responsibilities in the overall management direction of laboratories, which will, of course, result in improved overall compliance and accurate and reliable testing.
Thank you, Dan. I applaud the decision to allow associate degree MLTs to serve as technical consultants with the required 4 years of experience. Keep in mind, that's my opinion, not necessarily that of COLA. I have heard from several rural laboratories whose technical consultants visit once per month and who do not routinely use the equipment for which they must assess competency for the testing personnel. It seems that a very experienced MLT working at the laboratory and using and maintaining the equipment on a regular basis is in a better position to assess competency than a visiting technical consultant who does not work in the laboratory on a regular basis. So on behalf of some very competent and experienced MLTs, I'd like to thank CMS for, as of December 28th, allowing MLTs with required experience to serve as technical consultants. Well, so where am I going with this? Well, competency assessment citations have also been among the top 10 citations for CLIA as well as COLA and other accrediting organizations for many years. Do you expect this change to make it easier for rural laboratories to be in compliance with competency assessment requirements? And what will CMS do to monitor the efficacy of this revision?
Overall, I think the new personnel regulations will provide more pathways for individuals to qualify. And I think this revision will help laboratories obtain qualified technical consultants in the rural areas. And as we talked about before, CMS will continue to monitor deficiency trends from year to year and look at that information.
Thank you, Dan.
Dan, thank you so much for sharing these thoughts on Talk Lab to me. Would you like to share any final thoughts?
No, I just want to thank you for inviting me and giving the opportunity for this conversation and be able to get this information out to folks. I appreciate it.
Absolutely. This is critical information that our laboratories need to know. I would like to thank Dan and Kathy for being on the first episode of Talk Lab to Me. And as we conclude, I want to thank you, audience, for joining me on Talk Lab to Me. And until next time, stay compliant, stay curious, and keep talking lab to me. COLA will be hosting a live webinar to discuss CLIA personnel requirement changes with our very own Director of Accreditation, Eamon Tiffany, and our Technical Training Specialist, Nicole Kobe, on November 19th at 1 p.m. Eastern Time. If you're interested in continuing the conversation, please email learn@cola.org.